The cannabis community includes a diverse set of activists and nonprofits working to end the prohibition of marijuana. We take the time to hear the stories of reform on the Russ Belville Show's Cannabis Community Chat.
Welcome back, everybody. Half past the hour here, and joining us at Brightside Dispensary, we have the owner of Brightside, Kaliko Castille, and one of the, I don't know what, patient...
We're calling them patient advisors here at Brightside.
I'm digging that. Okay, so we got a patient advisor, Todd Armstrong. Yes. How you doing, guys?
Excellent. Yourself?
Fantastic. Great to be here. It's nice to be at the building finally. I know been a lot of hassles that you tried to put the building together, right?
Well, I mean, it was an 8-week process. We signed our lease on July 25th, and we opened yesterday, September the 25th. So, it was like an 8-week construction project that we managed to get done and managed to get open. I wouldn't say it was too hectic of a process. I think being able to pull it off in 8 weeks, I'm certainly proud of our ability to do that, having to construct it all, get everything permitted through the city, trying to do everything above board, obviously trying to raise the bar here in the cannabis industry and trying to do everything professionally and above board. So so that we don't have people knocking on our doors for any reasons that would get us in trouble.
So, speaking of that, Oregon just passed a dispensary law. The House bill, was it 3460?
3460.
It just passed, but where are we timeline-wise? I mean, is this a little premature? Is it actually licensable yet?
Right, sure. So technically the licensing won't happen until March 2014. That's when the law will actually go into effect. That's when the rules and regulations from the Oregon Health Authority will be put out. But currently in Multnomah County, there are upwards of at least 50 dispensaries operating currently, and they're basically operating under the idea that the district attorney here in the county said that they're not going to prosecute as long as they're not selling over state lines, selling to people without cards, or selling to minors. And obviously, we're going to be, completely legitimate and above board. We plan on making sure that everybody's properly carded and identified before coming in. We have, a lot of security here at the spot that we're planning on, or that we do have implemented, but that I think is going to become a standard. So, we're definitely going to be trying to push forward the professional side of things.
So you're basically operating as if, 3460 was in effect right now.
Right, sure. As if it was in effect right now. We're going to try to be in a position so that when the rules and regulations come around in March, we're easily able to obtain our licensing. So we definitely want to be able to get the hit the ground running here in Multnomah County, since we're, have at least a little bit of leeway in order to operate. That way we can have things buttoned up, work out all the kinks and all the bugs, prior to March.
So what aspects of putting this together were new to you?
Everything, I would say, probably. I mean, I went.
What was harder than you expected?
It was a little bit tougher than I expected. I'd been working on a business plan for a few months prior to landing this opportunity. And so, I mean, I certainly had one set of ideas about how money was going to be spent or how that was going to work out in the construction timeline. But obviously, you get in here and you start trying to get contractors in here the end of summer when construction season's pretty busy, and it's tough to get people in here. So, I mean, there's definitely I had to harken back to my old student government days from high school, like putting on ASB and food drives, things like those nature, because it really was just a big project that I had to get everything lined up for, and everything had to be firing, at any given moment at the right time. So.
All right. Well, let's talk to Todd for a second here, because we know you as Todd Armstrong, comedian, and now you're Todd Armstrong, patient counselor. Advisor.
Yes, because bud tender just sounds too cheesy.
Too cheesy. So, what will you be advising the patients upon? I mean, let's look at this. We got some Brightside examples here, and this here I understand is Rocco's Wonder. So if the patient's coming in for some Rocco's Wonder, what are you going to advise?
That is our house blend. That is a fabulous blend of, as I remember it, is Neville's Haze and Cinderella 99. So it's a nice up sativa, good motivation for if you're looking for some daytime medicine. It's a personal favorite of a lot of folks that want something to do instead of just sit on the couch. But if you need that, we have plenty of indicas as well.
It sure is pretty.
Yes.
All right. So
everything we have is soil grown. It's organic as well. So coming from my own personal family need for quality organic medicine, that's why I'm here.
Well, here we have a Narnia.
Yes, another house blend of ours. Fabulous. That's a huge favorite around. That's actually skunk #1 with the Cinderella 99 as well. So Cinderella 99 is a good female for our breeders to use. And
now I understand each of these sativas we were looking at, or sativa DOMs we were looking at, was over 20% THC. We have a silver tip here, which I understand is your winner.
I would say our flagship, absolutely. 26.2%, multiple cannabinoids, THCV, CBD, CBN. And that is a combination of the Granddaddy Perp with the the Super Silver Haze. That's out of Montana originally. That's actually featured in this month's Canna issue, I believe. Cannabis Now issue, and right there next to the Blue Dreams, we have that in stock. And that's
yes, I understand that Silvertip bud was bigger when it was first brought in here. I don't know what happened to it.
It's all accounted for. It's all in the system.
It's all in the system.
Every single gram.
Yeah, so tell us a little bit about that. I mean, I see BioTrack. I mean, you got to do all sorts of software, all sorts of things.
Kaliko's been up with that. I've been pretty impressed with the sense of our POS system. I mean, it tracks all the inventory, what we have coming up, and even tracks what a patient's previous likes were. So if they're a sativa purchaser, we can see that, make recommendations for them, and also inform them of what's coming around in the next few weeks that's being cured and dried.
Fantastic. Hey, folks, if you want to learn more about Brightside, you can check them out on Facebook. It's just Brightside on Facebook. It's Brightside PDX on Twitter and Instagram. Do you have a website?
BrightsidePDX.org.
Well, that fits out just perfectly. Now, the folks in the chat room are saying, hey, give us a tour. Folks, I've taken some video, and we'll do the video tour, but I have learned the hard way that trying to run videos on the remote is just about impossible. So
I say open up a second window, go like us on Facebook right now, and see every pitch you'd ever want. And listen and never miss a beat of this fabulous baritone voice right here.
That's right. And so you can just go like Brightside on Facebook right now. Look through the galleries, look through the photos. Do you have going to get some YouTube videos up maybe?
You know, we do have a YouTube channel. I just haven't thrown any videos up there. We definitely need to we'll get a tour video going here very soon. Like I said, we just opened yesterday. So there are a lot of things we plan on rolling out here in the upcoming weeks. So we'll be able to be found on Weed Maps and Leafly here, hopefully by next week. So a lot of things will be rolling out. You'll definitely be able to find us on all of the social media, all of the possible locations where you can find a dispensary. You will be able to find Brightside PDX for sure.
And that's this video here. We can put up on that.
No, absolutely. This might actually, I guess this could be the introduction video into the YouTube account for Brightside PDX.
Model onto the interwebs.
Yeah, there we go. So let's tell the folks that are watching the video, if they want to become patients at Brightside, what's the process that's involved?
Sure. Well, currently we're not doing a clinic, or we don't have any doctors on staff, but there are medical marijuana clinics in Portland, very, very many of them. You can check them out on Weed Maps, and you just have to be able to take your patient records to a pot-friendly doctor. Basically, what I usually recommend my family members to do is go to their personal doctor, receive their medical records, then go to one of these clinics. They will verify that you qualify under the Oregon Medical Marijuana Program as long as you have one of the qualifying conditions. And then the doctor will then write you a recommendation. You send off the filing fee to the state, and they'll send you your card out in just a few weeks. So, I mean, it's definitely one of those things where you just got to be able to get your own personal, records from your doctor. If it's not something you're comfortable talking to your personal doctor about, all you got to do is just get your records, say that you're applying for insurance or something, then go take that to one of these friendly clinics, and they'll be able to get you your recommendations.
Now, we saw a bunch of great flower that you've got here at Brightside, and patients now, of course, are demanding shatter and oils. How are you stocked on that?
Yeah, so we definitely, right now, we're carrying some Silvertip hash oil, some BHO, obviously made from our highest THC strain. We're in the process of getting that tested. All of our flowers have been tested here at the store. We're in the process of waiting for our results for our concentrates, but we know that if it was testing at 26, that obviously the Silvertip oil is going to be doing pretty decent. We're planning on having many more strains next week. Like I said, just opening yesterday. We did a pretty bare bones rollout, really soft open with most of our basic strains, but in the coming days, we're going to be having edibles, tinctures, salves, RSO. We'll have the whole gamut of everything you can think of, all of the possible ways you can medicate using cannabis. We plan on carrying here at Brightside, and definitely of the highest quality we can get our hands on. So we're definitely working towards that to make sure that we're working with suppliers and producers that we can trust and that we know are going to give high quality medicine to our patients.
Well, like you said, there was a lot of competition in Portland. There's 50 or more operating patient access points at this point. What's going to make Brightside stand out from the rest of them?
I think what's going to make us stand out is just being a professionally looking and a clean environment. I think that, a lot of people, without, pointing anybody out in Portland, I think that a lot of people associate medical marijuana dispensaries with kind of shady back alley sort of deals. They look at kind of sketched out smaller spots. This place is very large, it's very open, it's very it's welcoming. I think you walk in here and we have very tall ceilings. I think you walk in and you kind of feel at home. It's very comforting. And I think that obviously we're priding ourselves on carrying the highest quality medicine. Everybody's going to say that, but we're going to have the lab tested results to show you that we do mean that, and that, all of our flowers, all of our edibles, all of our concentrates will be tested. We've been going through Sunrise Analytical here in Portland. So I definitely think that we will be able to set ourselves apart by the fact that we're doing things in a way that, I guess this is another thing I should say. Well, there's no pot leaves on our building.
I saw that.
There's no green. There's no green on our building.
It looks like an Apple store.
Sure. That's definitely the feel that we want to have, a very clean and professional environment. We don't want somebody to just drive by and say, that's a medical marijuana dispensary.
Right.
Obviously we need people to know we're a dispensary so that we can get patients in here so they can get their medicine. But at the same time, we don't want to be, having to flash pot leaves and green crosses everywhere out there to get our message across. We think we can be subtle, clean, and professional and still get people to understand that we mean business and we're here for the patients.
Yeah, that's fantastic. And go ahead.
I think the thing that really sets Brightside apart from coming from, I guess, my side jobbing a comic is that we are completely focused on not swooping up a market that's already there. We're trying to envelop an envelope of new people to the business, of taking advantage of PTSD being encompassed in 3460, drawing in folks that are coming out of the closet because prohibition's kind of going away. The folks my parents' generation who use to medicate on a daily basis but are afraid to come out. And so I think we really are going to stand up by being more the quote-unquote suburban kind of draw. So
I also have to compliment you on your use of the heteronyms envelope and envelop in one sentence. That was wonderful. We have a little game picking those out, but that's neither here nor there. All right, we're here at Brightside PDX, Brightside PDX on Facebook, or on Twitter and Instagram, Brightside period on Facebook, right?
Yeah. Well, you could go to the search thing and find Facebook, find Brightside on Facebook. You also go to facebook.com/Brightside PDX. So we are trying to keep it uniform. Brightside PDX pretty much on everything.
Excellent. All right. And folks, come down here. Remember, the first 5 people that come in to get their medicine, first 5 patients to get their medicine here, get a free Russ Belleville Show pin, $15 value. Or if you're not in town, just go online to 420radio.org. Click on our shop. You can buy it from there. And I notice you guys have like T-shirts, and you're gonna have other stuff.
Yeah, we definitely
non-marijuana stuff.
We have some Brightside T-shirts. We're gonna have some other accessories. We'll have some pipes and some bongs and things like that. Things for people to be able to at least consume their medicine if they leave here. Some people, might come here, first-time medical marijuana patient, first time ever going into a dispensary. You want to be able for someone to come in here and have everything necessary for them to go home and medicate for themselves, and so they can be self-sufficient. So we'll definitely be carrying all of the accessories you can think of. We'll be carrying some local products from just stores around in town. We'll be partnering up with some local businesses in town and carrying some local products that we think should be pushed. So definitely have a lot of things other than cannabis here.
All right, Kaliko Castille and Todd Armstrong from Brightside. Check them out. Thanks, guys, for stopping in.
Thank you, Russ. Appreciate it.
Come back. We'll have time for a radical rant on the top 5 pro-pot myths.
The Russ Belleville Show is blogging and podcasting daily at radicalruss.com.